Welcome, everybody. Just starting to let everybody in. So give me a moment here to catch up. And just so everybody knows, we are recording this. We're recording this so the recording will be available. There'll be an email that goes out tomorrow. So feel free to share it with anybody. And the recording will just have the speaker views. Don't worry about if you're on camera right now, if you're going to be seen in the recording, I'll just put out the speaker view for that. And we'll probably have a few other people come in, but we will go ahead and get started. Let me introduce you to our guest this evening. This is Sharon Kron. She's a family nurse practitioner, traditional naturopath, and a registered nurse. She's the owner of K6 Wellness Center in Dallas. And I'm going to let her tell you a lot more about herself, but just a little bit from her bio through her own personal experience, as well as extensive and ongoing education with leading experts in functional, alternative, and allopathic arenas. She's bringing the best of time-tested truths and the latest scientific research together to help her clients recover from acute and chronic health. And specifically tonight, we're going to get into one of those areas, which is neurotherapy. But I'm going to turn it over to Sharon for a moment, let her tell you a little bit more about herself. And then we've got some questions we'll go through. If you guys have any questions as we go through, go ahead and put them in the chat and I'll keep an eye on that and we'll try to get to those as well. But Sharon, thank you for being here tonight.
Thank you for inviting me. It's good to be here. Neurotherapy is, yes, definitely something I'm really excited about, but I have been in the naturopathic arena for 20 years now. And that has been definitely the big call on my life. And then more recently, I've come into more traditional medicine with a family nurse practitioner. But I just wanted to bring a more well-rounded approach to my practice. And being a nurse practitioner allows me to do things like neurotherapy, get my hands on some procaine and some needles that you can't really do in Texas without that. So I have really enjoyed being able to bring neurotherapy into my practice. And I've been in practice in the Dallas area since 2006, and it's been a lot of fun right now in North Dallas. And I have a small practice here. I call it a small practice. It's big. We're busting at the seams.
Thriving.
We are thriving, but I love it. I'm very blessed. I'm married, have 4 grown daughters, 2 beautiful grandchildren, 1 more on the way. Yeah, got a great family, great friends, and yeah, great practice. So that's me in a nutshell.
Oh, perfect. And just so everybody knows our connection, I was actually referred to Sharon by a therapist that I've seen. And so I've actually received neural therapy injections. And that's how she and I started talking and got to this point. So we'll just jump right in here. So for those that aren't familiar with neurotherapy, can you tell us a little bit about what is neurotherapy, what's used in neurotherapy, and then we'll take it from there.
Yeah. So neurotherapy is based on the theory that basically any trauma or infection or surgery can damage a portion of your autonomic nervous system. And this can produce any kind of long-standing disturbance in your electrochemical or electromagnetic function in your tissues. And we call these disturbances interference fields. And we call it that because it will interfere with your body's normal ability to function. And that interference field can cause a disruption in the function of the nervous system. It can cause pain, or it can even contribute to disease, and it can be localized or it can be widespread. And I guess I should back up. Like, I'm assuming everybody knows what the autonomic nervous system is, but we should say the autonomic nervous system it's the part of I always think of it as the automatic part of your nervous system. It controls things that happen automatically. And there's 2 branches of that. You've got your parasympathetic nervous system and you've got your sympathetic nervous system. And your parasympathetic, you can think of as maybe the breaks, or it's rest and digest, feed and breathe. That's what we call it. And then your sympathetic nervous system is the fight or flight or fright, the gas pedal approach. And it's not that you're all of one and or all of the other. There is this balance, right? It's a balanced approach, and there should definitely be more of the parasympathetic than the sympathetic. That's not always what happens, but ideally, we would be more in a rest and digest state of mind or state of living. But anyway, neurotherapy does work on your autonomic nervous system. And being that it's an injection-based technique, we're trying to regulate the autonomic nervous system and the immune system, as well as trying to stimulate the healing process for whatever area we're working on. And we use procaine to do that. And procaine is in the cane family, like cocaine or lidocaine or novocaine, all the canes. Those are local anesthetics. But all of these anesthetics, yes, we use those to numb. So if you go to get sutures at the hospital or you're going to have dental work done, they're going to use something usually in this family to temporarily numb an area. And procaine is very light. I think its half-life is like 20 minutes. So you're not going to be numb for very long. And we use it too because there's really I don't think there's any recorded allergic reaction to it. That's not to say you can be allergic to anything, but we've never seen it. So that's nice to be able to report. But yeah, we use the procaine because it improves the communication between nerves. It hyperpolarizes cells. So it's going to improve communication, and it helps restore normal, healthy communication. So where that's been broken, you can have pain happening. Or in the case of scars, you may not have any sensation, you may not have any feeling, but you can also have limited mobility. And that can be very cumbersome. It can be painful in and of itself. And oftentimes in neurotherapy, we'll use the addition of ozone to help break up adhesions that come along with scars, to help improve mobility. And it helps make the work of physical therapy and other rehabilitative processes more productive and effective.
So, real quick, you mentioned the ozone component. So, for those that maybe don't, so a lot of times we hear ozone and we think about the atmosphere. But
Yeah.
for those that don't know about ozone in a holistic environment, what is ozone? What does it do? Why would we use it in this case?
Okay, so ozone, or oxygen, as we see it in the atmosphere, it's O2, right? So ozone is O3. It's very unstable, and it doesn't want to stay that way. It wants to go to O2. But ozone is, you smell ozone, it's a smell after it rains, right? But it's an irritant. It's not stable. If you inhale ozone, it will be bad for your lungs. It can do some damage. But ozone is very anti-inflammatory, and it is also antimicrobial. So it can help to kill infections. It will help to kill a lot of bacteria. As we use it in neurotherapy, oftentimes we will follow procaine with a little bit of ozone gas subcutaneously injected just under the skin, often into scar tissue, because it will help to break up adhesions or help to loosen the fascia. And so it just brings greater mobility, and it is acting in an anti-inflammatory manner to help heal up an area of inflammation, and it can help relieve pain. So that's how we're using it in neurotherapy.
No, that's perfect. And just going to ask this question because I know a lot of people that are going to either watch this or that are on this now are more holistic minded. And usually their goal is to avoid things like injections. And so in this scenario, why would you mentioned the protein, like it's got a short half life, there's no allergies, but for somebody that might be concerned about, hey, do I really want to put procaine in my body? Is that similar to a steroid injection and what a steroid do? What would you say to them?
That's a really good question. So It is not the same. It is, in fact, quite different because, and I'm not going to bash steroids necessarily, but steroids have their place, right? They're very anti-inflammatory. But even an orthopedic doctor who's injecting a steroid or a physician who's going to inject steroids, they're going to tell you, you don't want to do this all the time because it does break down. If you're rubbing steroid ointment on your skin all the time, over time, it's going to break down your skin. If you're injecting into a joint over time, it's going to break down that joint. It's hard on your bones. It's hard on your skin. Steroids, if you're taking them orally or systemically, they suppress your immune system. They are hard on your body. If you're using them rarely, they can be very beneficial if you just need to get out of a really crazy inflammatory moment. Procaine is not going to break down anything except inflammation. It's going to reset. It's really about improving, hyperpolarizing a cell. It's about restoring this communication link, and it's in and out of your system in no time. It really disappears quickly. There is no negative to its effects on your bone, on your tissue. So that's a really nice component of Procaine.
100%. Does it make a difference, say somebody that has an MTHFR variation, maybe somebody that knows they have a hard time detoxifying? Is Procaine harder to get out in that scenario?
No, the MTHFR polymorphism that we see with people tends to affect, definitely it's a detoxification, very related to DNA repair, cellular repair, which is a function of folate. In fact, people who have that polymorphism, we often see it's not just folate, it can be many supplements and medications that they have a problem with. And I've actually seen this. One of my daughters has several deletions. Like if MTHFR were all she had, we would be grateful. But where somebody may have a polymorphism, an aberration, or a departure from normal, she's like missing the whole thing. And so she can't take things. And Procaine has been really helpful for her because it is in and out of her system. There's not this big metabolic requirement of her cells because the half-life is so short, but it has done so much for the inflammation in her body that where she can take folate once a week. She's able to take Procaine once every week or two as she needs it systemically and get great anti-inflammatory support. Yeah.
I think that's great. So now that we got all of that out of the way.
Yeah, you're asking hard questions
I
here.
know I didn't prep you for those, but I know the audience, right? And I know that these are going to be questions that we're going to get. And so if we can just get those out of the way, because it's things that I would think through and think,
Yeah.
if I'm trying to live a more holistic lifestyle, typically I'm trying to avoid more of the pharmaceutical side. What we want to consider, in this case, a milder pharmaceutical. And so I think you did a great job answering. Like, it's not a big metabolic burden. It comes out of the body quickly, even in people that typically do have a harder time getting things out of their body. So let's talk about what would be some of the reasons, some of the conditions that would benefit from neural therapy.
So there's so many.
Why don't we do this? Why don't we start, since we're talking from in my case, a physical therapy standpoint, why don't we start with the musculoskeletal ones, and then we can kind of branch from there.
Okay, so that's a good one. And one of the first things I think of, especially when I get like athletes, for instance, they'll come in and say, okay, I have this injury. And invariably I look at the injury, and if I see scars around that injury, I got to do the scars first, because the scars invariably are going to be linked to limited mobility. And it's not always the size of the scar that matters. You could have a huge scar, but that might not be the problem. It could be that little bitty one, a little puncture wound or something. But scars are a really big deal. And then anything where there's like sciatica, anything, low back. We could even just start there. So anything in the lumbar area, we can go paraspinal, doing trigger point to help loosen up. For me, is doing the neurotherapy because I don't do PT. I'm the one making the referral to PT. But definitely getting into the whole lumbar region and even going further in to the celiac ganglion and just bathing the ganglion in procaine to help improve chronic GI issues, which sometimes, people, if you ask them, and probably PTs, this, people who have low back problems often have GI issues. And it's not coincidental that celiac ganglion's hanging out there by those seized up paraspinals and a little upset and angry. But yeah, knees are a big one too, and I am not doing ultrasound guided joint interarticular joint injections. The beautiful thing about neurotherapy is most of these are subcutaneous. So I'm truly just going under the skin with a teeny tiny little 1/2 inch needle, and just really it's giving information to the body because again, what we're doing is accessing the nervous system, right? We're giving information to the body, and it's just a way to get the body to do something different. And if you think about it, that's what you're doing when you're dry needling in physical therapy. You're stimulating, whether it's a meridian or a nerve branch, or you're going along these informational lines, conductive pathways, meridians, whatever it is, we're giving different information to the body in some sense. And whether it's to relax a muscle, improve flexibility, break up fascia, but that is one of the things that I'm doing all over the body, on the foot, in the ankle, the knees, anywhere, really and truly, even in the neck. But trigger point's a big one. Definitely joints, all the joints.
Would you say with the trigger point, because there are other types of trigger point injections that typically use a steroid, would you say that this is a good alternative to that?
Absolutely. It's less painful, and it's definitely less painful.
That's
And
a
you
good
get to be
start.
numb afterwards for a few minutes.
And we probably should have started with the needle aspect of this, like the size of the needle. So I'm glad you brought that up because that's going to be one
Yeah.
thing we're going to ask about is how big of a needle, how long of a needle, what gauge. So you said like 1/2 inch, teeny tiny in most cases, right?
Yeah. Subcutaneous shots are little 1/2 inch needles, and they're 30 gauge needles. So they're tiny needles. They're almost like acupuncture needles. Now, if I'm doing a trigger point, it's going to be a longer needle. It'll be like 1.25 inches, 1.5 inches, but it depends on the size of the person. Because if I have a little 120-pound woman, I'm not going to get a 2-inch needle to get into her glute. If I have a collegiate athlete, like a lineman, I'm gonna probably pull out my 2-inch needle to get into his glute because I have to. There's more body habitus. There's just more to get through, and I want to be effective, but it's not gonna feel any different. And also, you're never gonna see the needle.
That's a big player sometimes is not seeing it. It makes it a lot easier to go through.
Yeah. And truly, I will tell you, and I'm assuming there are some nurses and providers on here. Sometimes the most needle phobic people are nurses and doctors, but
Yeah.
anyone can have needle trauma in their past. And I think that's a big part of it. And if you do have needle trauma or bad memories, bad experiences, that can make it very difficult to even consider an injection based therapy. But that's where it matters, the setting, the environment, the skill of the clinician doing it. And so I just always try to set people at ease and just make sure you have a good understanding of what to expect. And of course, there are a few shots that I do, and you know this. There's some long needles that we're not piercing organs and things like that, but being in a relaxed state of mind and having confidence in the person working on you is important. And I like for my clients to feel good about where they're at and to have confidence in me and to know that I'm going to take care of them and that they're in good hands. And yeah. And we talk. That's the thing. You're not sitting there like you're on an OR table. We're having conversation. You're talking to me as we do this, no matter where I'm at on your body and no matter how little or long the needle is. We're talking through the whole thing because this is an exercise in communication because every person has gone through different experiences and has a different experience as far as how they got to where they're at and what they're feeling when we're doing the therapy. And so it's important to talk through it. Oh, I feel that feels hard, or that kind of hurts, or that feels sharp, or that feels dull. I don't feel anything at all, so that I know, what I'm going to do next.
Yeah, no, that's a great point. And not just with neural therapy or injections, but with any type of treatment, having that rapport with your provider and that communication, it's always going to put you at more ease, allow for more trust, and ultimately better outcomes. So I'm so glad you touched on that. All right. So you mentioned things like joints, muscles. You mentioned the celiac ganglion and some GI issues. I want to start asking you a little bit more about some of the others things that neurotherapy can be helpful for, because I'm just looking at some of the people on here. And so I know that there's more than just traditional musculoskeletal issues at hand, which for those of you on here, if you want to throw in the chat if there's a certain area or certain condition that you're curious about, so that way we can try to touch on that as well.
You want me to name off a laundry list of things?
Let's do it. Let's do it.
Okay. I'll do this. But then and that may get your creative juices flowing, so y'all can feel free to ask. But genitourinary, anything in the pelvic bowl, UTIs, interstitial cystitis, infertility, impotence, incontinence, any IBD, IBS, prostate issues, sciatica, GERD, anything respiratory, COPD, emphysema, pneumonia, bronchitis, histamine issues, RSV, pneumonia, mold illness, asthma, mental health issues like depression and anxiety. For me, especially when I'm helping my clients wean off their antidepressants, I will do one specific injection when I'm getting ready to decrease the med because it helps to blunt the withdrawal. Chronic and acute, I think I said this, chronic and acute kidney and bladder infections. Let's see, lymphatic issues, lymphatic stagnation and congestion, headaches, migraines, COVID and long hauler issues, PANS and PANDAS, fertility, TMJ. I also do an offshoot called perineural therapy where we mix a 5% dextrose and sometimes even B12 when we're working on joints or musculoskeletal issues. And yeah, there you go. And that's just some of it. So I was just brainstorming this afternoon.
Oh, that's perfect. And for those on here, like I'm learning with you, like there were some things she named, like the histamine, I think maybe you and I had talked a little bit about mold, but the histamine, the mental health, the PANS, PANDAS, you and I haven't talked about this, but I have a daughter that has PANDAS.
Really?
And really PANS at this point, but she will never let you give her an injection. But that is good to know.
I generally don't inject under age 18 just for
Then we got time
liability.
to convince her. It's fine.
And that one's a little stingy, so I don't think getting a kid's up hold tight for that one would be easy anyway.
All right, let's see. Where do you inject for lymphatic congestion? That's a good question. That's in the chat.
So for lymphatic congestion, there are several areas. There's one called the professor, and it depends on where you're feeling it, honestly. The professor, we go down the occipital lymphatic chain. We can do the anterior lymphatic chain. One of my favorite to start is we call it the lymph belt, and it's just subclavicular. So it's right under the lymph belt. And one thing that I do is if the person also has immune system problems, like if you get frequent infections, I will draw like 1 cc of that person's blood and I mix it with the procaine. And this is called Heme therapy. I didn't even put this in my notes. I forgot. And I will, if they're okay with looking like they had hickeys, I will inject those subcutaneously all across the front of the clavicle because it's injecting the person with their own blood and the procaine. So it's an immune system boost as well. And that really helps to get the immune system going. And then we do one on the sternum for thymus, inguinal lymph. I'll do it just right along the groin in the inguinal line. For the knee, we'll go in the popliteal fossa just to work that. So anywhere you have major lymphatic areas, we can do it. But those are the main areas are the anterior lymph. We will do the preauricular and then sometimes postauricular lymphatic points as well. But those are all very shallow, pretty innocuous, easy to take injections, and they do help. And I like for people to do those and then have a little lymphatic therapy done because it really does help spread it and make the lymph therapy more effective.
Yeah. That was
If you don't have a hot date, when you can stay home and cover up, the auto heme therapy is even nicer.
That's really cool to know about. On the same topic, the question was small needles. So are we talking like the 1/2 inch needles, 30 gauge needles that you talked about earlier that are just subcutaneous?
All the lymph are very small. Yeah. And we do thyroid injections too. And I do actually go into the thyroid tissue.
And I can say from some of the injections that Sharon's done on me, she's done some of the lymphatic ones, and those are actually the ones I feel the least go in. Like she's done some in my abdomen, but when she's done the lymph ones, those are like a little pinprick, and that's about it. And I know everybody's going to feel things differently, but I can attest that those are very small needles. Another quick question on this. Have you had any benefit using this for things like neuropathy and tremors?
I have not personally done any tremors.
Let me give you maybe some background because I think there's another topic you could probably explore on this particular question. What about with Parkinson's? I know there's other injections you and I have talked about. So if you
Yeah.
because I think this might be why this person is asking this.
I have not. I don't know that neural therapy will accomplish with now, yeah, if it's a Parkinsonian tremor versus an essential tremor, I think there's going to be some differences. And honestly, I'm thinking a more systemic treatment, which with neural therapy, we do. One of my favorite ways to introduce the whole system to procaine, if you're procaine naive, meaning you've never used it before, is to do a small IV push. So we just take 5 cc's of procaine. And again, I'll usually pull back a little bit of your blood and just, we say, marry it. So we mix it in. And then over a period of 2 minutes, we do a slow push of the procaine into your system. You'll feel maybe a little buzzy. We're not knocking anybody out. We're not making anybody drunk. And remember, the half-life on this is really short. So you might feel happy for a few minutes, but that goes away pretty quick. It's really that autonomic reset. So I can't really say if that would eliminate a tremor. With the tremors, I'm usually doing other things ahead of that, like grounding, reducing EMFs. I am now venturing into exosomes, which is a whole other conversation that I don't want to detract from neural therapy, but there's a lot of promise. So go to Google Scholar and research that, and we can talk about that at another time. But exosomes, I think, are going to be really big for that. Neural therapy, I think, does offer a lot for, definitely improving nervous system function. But then I think you also have to look at dopamine receptors, of course, and then what are the triggering factors behind it. And neural therapy is going to play a role in some sense, but I feel like definitely some of the more systemic and anything brain related, there is one, and this is one we do for pans and pandas, and it's called the crown of thorns. And it's exactly that. Like we're going shallow needles, but because you can't go real deep on your skull, right? It's just skin and bone. And so we're going around the scalp with very shallow shots of procaine to help reduce inflammation.
Perfect. Like I said, I knew that one was related to Parkinson's, so I wanted you to bring up the exosome so they could at least go look more into it, and she
Yeah.
will. It's good.
Yeah. Yeah. You can reach out to me later about the exosomes.
Perfect. There you go. She said thank you.
Absolutely.
So, when it comes to neurotherapy, how do you know who's a good candidate? A lot of our patients at R3 they've typically tried a lot of things. They've tried a traditional approach, whether it's PT, massage, chiropractic, injections. A lot of times that's why they've found us because they're wanting something different. So if they're thinking like, is this really something that would help me? Like how would they know if they're potentially a good candidate? How do you know if they're a good candidate?
I think neurotherapy is a tool that works so well with many other modalities: physical therapy, acupuncture, chiropractic. And I often use it in conjunction with other work like lymphatic therapy in my practice, energy work, not crazy stuff, but like real energy work, acupressure, craniosacral therapy. We do a lot of detoxification. And I work with a lot of other providers and practitioners like you. I think that for people who have tried everything, let's put it this way, I seldom see any one modality as there's one thing and it's going to fix everything. I don't see it. I don't think pills fix everything, and I don't think supplements fix everything. I think that we have a lot of tools, and it's often finding what's the right combination of tools for you to have in your toolbox. And I think that it's important to use that. I will say neural therapy, it's a, and I think this is something you probably have seen this. We haven't talked about this, but neural therapy can be really good at evoking an emotional release. And sometimes, and you probably see this because you put your hands on people's bodies. And sometimes you've got to get somebody to have that emotional release, to have this breakthrough with them in their healing journey. And so I think that neural therapy is a tool, and sometimes it catches people by surprise, their response to it, whether it's an emotional release, because I can't tell you how many times I've just put a needle in and it didn't hurt, but they just burst into tears and they're like, "What is happening? What did you do to me?" And I said, "Oh, I forgot to tell you, this could bring about an emotional release, but it's okay. You're fine. I just breathe through it. It's okay. Process whatever emotion or experience you're thinking about, and let's let this pass so that you can heal and feel better." And it happened to me in class when I was embarrassed. I was like, I do not want to cry in front of a room full of doctors. This is not my idea of a fun day. But you just have to roll with it. And I think when we're going through our healing journey, sometimes that's what it is. But I think that as far as if you've tried medication, if you've tried PT, if you've had surgery, and it wasn't everything you thought it would be, or maybe you feel like you're worse now, maybe you fixed one thing, but something else broke. Okay, I had surgery, it fixed the thing, but now I have now I have scars, or now I have pain in this other area because they had my body in a weird position while I was unconscious. Or we hear all the things, right? So I think that neural therapy is really good at just being one tool to help release constriction, whether it's releasing the fascia, it's improving mobility, it's releasing emotions that get tied up inside of us. Yeah, I think that it can be a really valuable tool. Another example, I'll share a personal one. My husband, we've been married since we were children, but I guess it's been 30 years ago, he got spinal meningitis, and I was 6 months pregnant with our second child, and I thought he was going to die. They scared me to death, and it took 3 days at that time to find out if it was bacterial or viral. So they thought they scared us about everything. there was a lot of emotion and fear, and he was in isolation, and it was viral meningitis, long story short. He had a bad sinus infection, went to his brain. Okay, and ever since then, we've been very careful about sinus infections. And then I grew up and became a naturopath, and we learned all about allergy desensitizations, and we've been very mindful. Now he does mold inspections, but he's very sensitive to mold now because even though he wears the hazmat, the respirator, and all the things, but with neurotherapy, we've realized if I do injections into his sinuses after he does a mold inspection, his life is so much better. So now it's a house rule. You do a mold inspection, you get a sinus injection, and life is better. So here again, it's just a beautiful tool where there's no sinus rinse that does what an injection with procaine and ozone can do for him. And there's 3 different sinus injections that we can do. And he knows exactly which one he needs because I held him down and made him take all 3 of them to figure out which one was best for him. And
Yeah.
now he knows. So it can be a really helpful tool. And I have clients who now they know, they're like, the one that you did when you went through my mouth, that's the one, or the one when you went through my temple, which it sounds horrible and it's not horrible. But people go through it one time and they're like, oh, I thought it was going to be bad. That's all it is. That's nothing. And I feel so much better. So neurotherapy is a beautiful tool, and it's a tool. It's not a cure-all, right?
That's great. And there's some questions we'll come back to that are getting put in the chat, but you had mentioned the emotional release. And like we see that in our practice, 'cause we do a lot of different type of treatments. Like we work with the fascia that surrounds the organs. And from an Eastern medicine standpoint, they view the body as certain organs storing certain emotions. And so there's maybe this overwhelming event or this ongoing stressor, whether that's emotional trauma, stressful event that your body just wasn't able to come down from. It can be stored in the fascia and through the nervous system, and then it can manifest in physical ways, which a lot of times is what brings them into a place like a physical therapy practice, because maybe they're having shoulder pain, but it's maybe related to their liver, or maybe it's something related to a heartbreak. And so the fascia that surrounds pericardium. Are there times that, because you mentioned also earlier, mental health is one of the things that you sometimes use it for. Are there times that you will specifically use neurotherapy to address those emotional components, or are you usually just seeing those emotional releases happen because you're doing neurotherapy on something specific that hurts? Does that make sense?
It's usually the latter, to be perfectly honest, unless I am specifically treating somebody with depression or anxiety, and we're working on neurotherapy, and I'll say, hey, how about I do a first cervical injection since we're working on this? Let's go ahead. Because the thing is, like, I'll go in right in here and I'm not hitting a vein. I'm not hitting an artery or a muscle. I'm going into the space, and we're just bathing that first cervical ganglion, just washing it. And it has an effect on mental health, but it has a really good effect on headaches, on migraines, on GERD, any upper gastrointestinal issue. It can have a very positive effect. And that's something where I do get a lot of feedback from clients who say, I realize that I'm a lot calmer. I'm less reactive to people who tend to trigger me, or I actually feel more level. They're not giddy. They're not euphoric. They just feel more level. And I feel like overall, that's a nice way to be, right? Just to feel a little more stable. There are actually a lot of papers, if you go to Google Scholar or you go anywhere and you can look up there's controlled or clinical trials on PTSD and the stellate ganglion injections. Now, they usually do it with, I think everything you'll see would be on an ultrasound guided stellate ganglion block. And I don't do blocks because I'm not using ultrasound guidance. I am doing an injection because I'm not going like into the ganglion. but we do the injection, and that is shown to improve PTSD. Yeah, they've actually done studies with that, so that's cool too. But and I think they might be using ropivacaine for the trials, but they've done it on veterans.
Very interesting.
Yeah, yeah.
And let me ask you some of these questions that were in the chat because they're related to some of the other things that maybe it's helpful for. Things like sleep apnea. Have you seen neurotherapy be helpful for sleep apnea?
So that's a good question. Sleep apnea, depending on what it's for. So we do help with people who are getting airway work done with their dentist. We'll do a lot of the preauricular, like doing TMJ work. And those are subcutaneous, very shallow injections, but it does really help relax the muscles. So before they go get their cranial sacral work done, I'll do the injections because it just makes all the movement easier and it seems to hold quite well. There is a tonsillar shot. I am not shooting the tonsils. However, we're going into the retromolar, the trigon region of the back of the mouth. And that does help with any swelling, if there's tonsillitis, sore throats, things like that. It can help relieve inflammation in that area. And we can't even go in that area with ozone. I do also treat, like I just had somebody who had cavitation surgery. And so I'm following up that dentist's work with injections of procaine and ozone to make sure, because there was a huge infection in there. And so we'll continue to treat with ozone because that's an area that you can take all the antibiotics you want. It's not going to get in there. It's better treated with ozone. And also one other thing is we have injectable homeopathics that we can put in. So where there's been injury, we have the Tramiel, it's a German homeopathic. And when customs doesn't seize my product, I have it.
We talked about that yesterday. So I actually got Tramiel in my, I was there yesterday and had Tramiel. And she and I were talking, like I had seen Tramiel years ago in the cream form, didn't realize it was injectable. So she was telling me that story. And so now she does have it. So that's good. Let that through. You mentioned some of the dental stuff. That's good. I wanted to ask you about neurotherapy and dental work and airway, because I know you have a therapist near you that does a lot of TMJ and airway. We also do a lot of TMJ and airway work. So we work with some biological dentists. We work with myofunctional therapists. And is there anything else in that arena that you can expound on that you've seen helpful with those types of patients, whether it's neurotherapy and then followed up with some of the manual therapy, PT work, or neurotherapy, and any of the orthosis that maybe they're getting like for expansion and alignment, things like that?
Yeah, generally, I think going in and doing the neural before they go have any of the manual work done, whether it's cranial or the myofunctional, I think that it really makes the other therapist work more effective. Probably, I don't want to say easier because that's not the right word, but I feel like it preps the body, right? Like we've just reset the the autonomic nervous system. So we've just really helped bring up the parasympathetic so that the body's ready to accept this reset. And that's what this is all about. This is really taking the body, and you think about a lot of airway. The reason we have the airway issues, the sleep apnea, what is it doing? You're not breathing. You're not getting good oxygenation. That puts you in this whole fight or flight or fright. Like you're constantly in this state of fighting it out, trying to survive because you're not oxygenated. And so when we're able to calm the body down, calm the brain down, and allow the body a moment to reset, and then allow a therapist to put their hands on you and get that structural realignment done, it's going to be a better outcome, and it's probably going to happen faster.
Perfect. And that may have answered one of these other questions, but let me bring it up in case you have anything else to add. Someone who has chronic back pain radiates down their buttocks into their legs, some nerve involvement. Where do you see neural therapy helping them either differently from manual therapy or in conjunction with manual therapy? What are your thoughts on that? What have you seen?
Depending on where that pain originates. So sometimes if it's, I usually poke around. So one of the things I will do in my assessment is a tissue roll beginning at the sacrum and rolling up, and where I feel the adhesions, then that's going to be where I go bilaterally beside the spine. And I'll do an intramuscular if that's what's indicated, like a trigger point. But also if it's in the sacral area, the SI area, I will do a deeper injection where your sacrum is that triangular shaped bone, and it's got the foramen, those holes, right? So I will inject into those holes, either the second or third down. And again, we're just bathing. You've got how many, the cauda equina down there, right? We're bathing all those nerve endings in a big, healthy helping of procaine, and it starts to relax everything. And so a lot of times that just allows the body a moment. And then I encourage people, okay, just let's lay there. And then a lot of times that calms down the muscles. If you've got spasming going on, then we can do just a little bit of injection there, and that'll calm it down. People get off the table and like, oh, fine. Okay, let's stretch that out a little bit, or go get your adjustment, go get your PT. And then some people aren't even under care at that point, but they just go home and they stretch it out, rest it, and they're fine. But yeah, we'll do the sacral shots for sciatica and anything low back related. And it really does help a lot. But that can actually even be for anything rectal, anal, prostate. Yeah, lower bowel.
Interesting.
Mm-hmm.
All right. Shifting gears on what neurotherapy can help with. What about evoking a more natural sleep-wake cycle or helping with insomnia?
Again, that's one where I would probably look at more the IV part of things, or the first cervical, looking at the just more of the brain, like doing something upper around the head. But I would also look, the naturopath in me is going to interrupt here. Sorry, can't break those two up. I would be asking a lot of questions about lifestyle at this point. Blue light exposure, EMFs, what's the bedroom environment? What time are you going to bed? What time is supper? Darkness and light and all this. I'm going to be building a retreat center in a few years. I've already bought my property, and I keep saying my first retreat is going to be a sleep retreat, and it's going to be a 2-week retreat because I am in the middle of nothing. My cell phone doesn't work on most of the land that I bought. And it's going to be like there, you turn in your cell phone. It's going to be a reprogramming, because I think a lot of it is just that our brains are on fire. We're so overwhelmed with stimulation. Even if you're coming home and turning off your computer, there's still just so much artificial light and stress, and we eat too late or things are turned up too loud. And I don't know. I would look at some of those things, and then we would have to look at hormones and cortisol. But as far as neurotherapy goes, yeah, I would be doing something more systemic like the IV push, and then possibly neck up.
Gotcha. Perfect. And then one more question from the chat, real quick. Any negative effects of procaine with regards to CRPS or pseudo gout, specifically things like triggering worsening symptoms or flare of symptoms?
I have not, no, I don't, no, because really, like, procaine is technically alkaloid. So it's not going to create a problem with uric acid. I'm thinking, no, I don't think so. I have not treated a complex regional pain case with this, but it would be interesting. I would love to, because I think that there would be a lot of benefit to be had. And again, exosomes.
Just thinking through it, it would definitely make sense if part of neural therapy is to really enhance the parasympathetic nervous system. With CRPS, we're looking at central sensitization or a hypersensitivity typically of the central nervous system. And a lot of times that means that sympathetic is really ramped up. And so
So high. Yeah.
so anything that would tend to dampen that and bring that down, bring your nervous system back into balance, it seems like it has the potential.
Yeah. And that's the beautiful thing about, to me, the IVs is that it does such a good job of just tamping down that sympathetic overdrive when things are just turned way too far up. Even honestly, the first one I ever had was when I went to training, and it was like boot camp because you're doing these shots to each other. And for me, somebody coming in your first day in, I'm not going to give you more than maybe 12 to 15 cc's of procaine your first day, unless you're a really big person. Then I might give you 20. We probably all took in 40 to 50 cc's our first day. And I took a bunch of binders, and they warned us, like, you may not feel good in the middle of the night. And I did not sleep. I felt terrible. And I took a bunch of binders, and it was not enough. And I staggered into class the next day. This is the worst hangover I've ever had. And they said, let's give her an IV. And they did the IV, and like it just went away. And I don't know how more procaine could do that, but it was just that reset. And that is definitely one of my favorite things to do for people, because you can watch people in the moment just reset, whether they are angry, whether they are in pain, whether they are just amped, stressed out to the max, whatever it is. It's not a cure-all, but it just is it's a reset. It just turns things down just a little bit and allows their autonomic nervous system a moment. So when you're dysautonomic, even people who are prone to that real dysautonomic, like they turn around and they faint, or just the cannot regulate anything, this is a really nice reboot.
Okay. That's really good to know. All right, I've got a couple other quick questions for you. And then if anybody here has any other questions, go ahead and start putting them in the chat. Also, just out of curiosity, for those that are here, put in the chat where you are listening from. Are you Fort Worth? Are you North Fort Worth, Keller? Do we have anybody from Dallas? Just kind of curiosity. I recognize a lot of names, but go ahead and put that in the chat, just out of curiosity. And then if you do have any other questions, start throwing those in the chat so we can get those in. But one question for you: any surprising areas of the body that you treated where neurotherapy helped that you did not expect?
I do have a funny one.
Okay.
I'll put a needle anywhere,
Yeah.
to be
Fair.
perfectly honest. But I had a client ask me to do like right inside the nostril. So if you were going to pull a nose hair out, does it make your eye water to like just think about pulling a nose? And I said, I'll do it, because there was like this swollen spot, and just do it there, because I know it'll go away. I was like, you got to hold still. And she's like, would you hold me down? I was like, nope. You're either going to hold still or I'm not doing it. I did. She nearly passed out, but I did. I injected. I feel like I'm picking my nose. So
It's
I
recorded, so this is
I
great.
know, for posterity, right? So right there, I injected it with procaine, and then I put ozone behind it. And I swear to you, she probably did pass out for 5 seconds, but then it was gone. She came back the next week. She's like, look, and it was normal, because it was swollen. She couldn't breathe very well. It was gone. But I don't know that it made my eyes water to do it. Oh, it hurt me to do it. But no, I'll stick a needle anywhere.
Fair. Once we're going to learn what works and what doesn't work.
Yeah.
If the patient is willing, then
One of the biggest things you do, the original scar, is one of the things that people freak out about. But what's your first scar? It's your belly button.
yeah.
Yeah. And so that is one that everybody probably should have treated, is their belly button. But it is one that people think is funny. But then some people are like, I don't know how I feel about this, but it really does help with anything abdominal.
That's the thing.
Yeah.
Fair. I'm glad you brought that one up. That's a good one to know.
Yeah.
Maybe next time I'm in, we should do my belly button.
I will do your belly button next time.
I just
Maybe
won't.
we'll film it. I'll show how to assess which side of the belly button to do
Yeah.
for educational purposes.
Right. Of course. Yeah. We'll do tag it onto this video. That'll be perfect. All right. So I know we do have a couple of providers on here, and there's going to be probably some providers that are going to watch this. So for providers, whether they're PTs, chiropractors, other naturopaths, physicians, dentists, what should they know about referring people to someone doing neurotherapy injections?
I love working with other providers. So I just want to know if you're sending somebody to me, I want to know why I'm seeing the person and what you expect out of the neurotherapy, because I think it's important. And I always tell my clients, look, you need a team. I think the more people we have working together for our clients, the better the outcome is going to be. And so I love to talk to other providers for my clients. I always want permission to discuss their case with their team, with the other people on their team. But I think it's really nice to just know what is your expectation and what do you feel like I need to know about this person. And then two, like there are some cases where I prefer to inject before they go get a certain therapy. And then there are some times where I want to inject after they've had a certain therapy. And that's when communication is really good to have. So whether it's a dentist or a physical therapist or a pelvic floor therapist, depending on what's being done, that communication is really nice. And it's so easy to do. Just takes a few minutes out of our day.
And I think the patients, clients are going to appreciate that too, knowing that their team is working together.
Looking out for them. Yeah, absolutely.
Absolutely. I'm going to get to one other question from the chat, but just looking through, we've got people from different parts of the Dallas area, different parts of Fort Worth area. Before I ask this next question, just the people that are here, those of you that have sat through this, had your questions answered, I'm just curious, are you anybody thinking like, hey, this is something for me? This is something that I think would benefit me. Go ahead and put me in the chat if you're thinking that. I'm just curious where everybody's at. And oh, gosh, that was quick. And the question was, is there any chance of addiction or dependence with neurotherapy? And maybe Procaine in particular.
No, I think because the half-life is so short and because we're doing a lot of times, these are subcutaneous. If I'm doing a subcutaneous shot, you are not going to get high, right? If we're mainlining this in great quantities, probably I guess you could get addicted to anything if you have that type of personality, but that's not really what we're doing. I have not experienced that at all with anyone. And honestly, unless you're addicted to needle sticks, and I have met very few of those, it's not really that. Yeah, most people want to see the results. I think they're like, I love the way this scar looks so much better, or they just want the results. And they do love to see the end result. That's what people are really in it for. And I think anyone who comes to this kind of work, they're very results driven.
And I'll say, I just lost my train of thought. I'm not that old. I shouldn't be losing my thought. With me, I will say this is something that the reason that I went to Sharon was I had been dealing with some nagging pain. Like it wasn't debilitating, but it's nagging for 3 years and have had a lot of treatments and they've been helpful, but there's just still a level that just stayed there. And I think I've done 4, injections with you now. And this has been something that definitely has pushed me beyond the plateau. She and I were talking yesterday. I had about 2.5 weeks of relief to a level that I really hadn't in 3 years. And I know it's something that can be helpful in conjunction with a lot of other things, and sometimes even to help push you over the edge to where maybe those other treatments and team members can continue to be more effective. I know what I was going to say. One of the things leading up to this webinar, I had a lot of people asking about was C-section scars. And you had mentioned like that scar looks better. And I'm thinking of a few patients right now that I know that's part of what we're treating is that C-section scar and the pain that's maybe still lingering from that. And imagine
Yeah.
that often.
Yeah. And C-section scars are one of those things. If you ever see a C-section, that I know the first one I watched, just no wonder women have such bad back pain after C-section. It's brutal. But C-section scars are so important to have treated. Whether or not you think you have a scar issue, please just go one time, at least go one time and get it treated. It's so important with scars, especially C-section. I have had that's been some of the most amazing results is to have women say that sex feels better, that their mobility is better, that they don't have incontinence like they did. Now, it didn't like cure incontinence because that can be triggered by many things. But to hear that, yeah, just the general pelvic sensations are completely different. That's a really big deal. And so period cramps go away. That's so big. And for women, just to not feel like they have a rope laying across their lower abdomen when they lay down, that you can actually get that scar to heal and get that keloided tissue to settle down. That's a really awesome way to, yeah, to end the scar therapy, get those results and get the real red angry to just be a soft, silvery white. The scar is still going to be there. You're
Right.
still going to see that, but it doesn't have to feel or act angry.
That's good. So there's not a lot of people doing neurotherapy. Like I've
Mhm.
heard of it. I had patients years ago do it, but there's really just not, if you do a search, there's not a lot of people doing it. And out of curiosity, like, where do you see the role of neurotherapy evolving more in the integrative space, functional medicine, holistic medicine? Like, where do you see that going in the near future?
We're in Texas. It's, it is,
Politics?
it's where I'm unique here. There's not very many of us, but there's not a lot of people. There are people who will do some injections and it's some version of it. But I really see neural therapy moving forward in a team approach. I really do using it as being part of somebody's team. I think that is still going to be the most important way. Healthcare is not in any way supposed to be this singular, one person fills all my needs type of industry because it's not a one size fits all. It's not that you can adjust everything to perfection. It's not that you can pill everything into health. You cannot cut and drug everything into health. And we can't eat our way into perfection. We can't work out our way. And it's all of the things. It's diet, it's lifestyle, it's the thoughts we think, it's the company we keep, it's the schedule we keep, it's all of it. And so I think that it's important to have people that are holistic in their approach to the way they treat our body, the way we treat our health, the way we treat sickness, right? So having a team approach, I think that is going to determine the future of neural therapy, using it as a part of a very comprehensive care plan for people, whether they're in an acute circumstance or if it's a part of a chronic pain management. That is that's the future. I think people need to know about it. Building awareness is a big part of that. And there's not a lot of awareness, I think, currently in this area, unfortunately. But I think also thinking outside the box, like with you, there's this one standard of injection technique, but with you, we're like, hey, let's get a little creative. Let's go closer to the source. Let's think outside the box a little and do something different. And I think that's important to do. So being willing to try new things within reason is important. And then, yeah, just integrating our hands with needles and ozone and procaine and B12 and dextrose and homeopathics, and putting all of the things together to build new methods and new tools and new ways and thought processes. Plus, you have a skill set that I don't possess. I have a skill set you don't possess. And I think when we put our heads together, then we're better together. And I think that the more people we bring to the table with, that's the future.
That couldn't agree more. That's a great answer. People obviously they're wanting to know like how do they get a hold of you? Where are you? So I want to make sure that we do give your information. But before we do that, for those of you that are in the Fort Worth, Keller area, like there really isn't anybody. I searched. I used Google. I used ChatGPT, which is I guess the new standard to search now. There's a guy in Arlington who's done it for years, but and I've had patients that have gone to him. And I can tell you he thinks differently than what we've been talking about here, more black and white, I think. But there's really not anybody around here. Sharon's about one of the closest around that does it. And Sharon has offered to come out and let R3 Physio host her and offer these injections. So we've already got a date set that she's going to come out June 9th. And so for those of you that are interested, I'm going to put an email in the chat. That's how they're going to handle the scheduling. So if you email Mary for specifically scheduling when Sharon comes to R3 Physio, they can help you get scheduled. And there, to some degree, there is going to be limited space because Sharon's only one person and she can see as many as she's willing to see in a day. But if that's something you're interested in, definitely email, because tomorrow morning, there's an email that's going to go out with this recording, and we're also going to announce that, and that's going to go out to not just 50 people, but 1,000 people. Not that all 1,000 are in this area, but a lot more. And so if that's something you're interested in, definitely don't wait. June 9th is the day. Look at your schedule. For those of you that are more on the Dallas side, how can they find you?
K6wellness.com is my website. And we are in North Dallas, just near Addison. And yeah, we're here Monday through Friday, except for June 9th. We're taking a field trip because that sounded fun. And why not?
I think you like this side of the Metroplex. It's different. I was driving back yesterday and I was like, man, I forgot how spread out Fort Worth is compared to Dallas still.
We love Fort Worth, and we ranch out by Wichita Falls. And we always said when we first moved here, my husband's job had not been in Dallas, we would have moved to Fort Worth because
we need to pick a Friday at some point so you can come out here and then you can just go right up onto Wichita Falls.
I know. Yeah.
You can back to Wichita Falls on this Monday or so. I don't know. But perfect. Any last minute thoughts on anything we talked about?
Neurotherapy is so much fun. I love all the things I do. And I think I do a lot of cool stuff, but I think you do a lot of cool stuff. I love what I do because it's so much fun to be able to help people in a new and a fresh way, and to be able to give people just a whole new perspective on their situation. Because sometimes we get so tired of feeling the way we feel because we felt this way for so long and we've heard the same thing over and it's just so old. And then to actually hear something that makes sense, and it's, I never thought of it that way before. But sometimes it can be scary. And in the spirit of first do no harm, neurotherapy is really nice because we're not harming. There's no risk. It's a proven technique. This has been done in Germany since 1915 using procaine. So it's just a really beautiful way to help the body find its balance, and it improves nerve communication. It's just good for your brain. It's good for your nervous system. There's so many wonderful things about it, wonderful things to love about it. Yeah. Yeah. I think just whether you're dealing with chronic or acute issues, it's a really out of the box way. If you're looking to stay away from pharmaceuticals or steroids, it is something to consider and to try. If it's something chronic, just know that it's probably not a one and done. You're probably going to be looking at a series of treatments, but it's not something that you have to, it's not something you're going to be addicted to because it's not addictive, but it's not something you have to keep doing forever either, because that's not what this is about.
That's great. And I think that's a good point to end on. Sharon, thank you so much for taking time on a Thursday evening to share more about neurotherapy. Thank you for the offer to come out here. I think a lot of people are looking for things like this. So, like I said, there'll be an email that goes out tomorrow with this recording. So feel free to share it. Anybody that has the email, feel free to share it with anybody that you think would benefit from it. June 9th, she's going to be out here with that. You can email Mary, which that email address is at the top, mary@k6wellness.com, and she can help with the getting scheduled. And then certainly if you have any questions, is the best way to reach out to you with questions through your website? Or should they ask Mary any questions? Like if they have any further questions about neurotherapy, would Mary be
Just either. Probably if you're going to come here, you can go straight through my website.
They're going to come to Dallas.
If you're going to come to Dallas, just go straight through my website.
Okay. And if they're going to come to Fort Worth to R3,
go through Mary.
Okay.
Mary's my back office assistant. This is her special project.
Perfect. And she was the one that really helped set this up. So I am very grateful for all the emails between her and I that we had. But Sharon, again, thank you. And thank you all for attending. And
thank you all.
Yeah.
Those are great questions.
Yeah, I think we had some really good questions, and I think some really good topics we talked about. All right. Have a great night. Thanks again. And I'll be seeing you soon.
Absolutely. Good night, everybody.